What I've got is, and we're still kind of in the, I don't know if you want to say we're in the diagnosis process, but in terms of uh, like what it's actually called, it's called a Chiari Malformation. I had a type 1. There's 3 different levels. Mine, I mean, they classify it, and the higher you get, the more severe a case it is. Essentially what it is it's due to kind of the shape of your cranium, the your brain essentially kind of gets forced down into the spinal canal, which can block the flow of spinal fluid that goes kind of up and down. And it's been known to cause dizziness. And I guess kind of the way that on my mission, I was about 4.5 months out, and I remember getting a headache one night, and so we went home early. It was a migraine. It's like I can't hardly work with this. And then the next day we went and were visiting with an investigator, and I just got really, really dizzy. It was like I couldn't hardly balance. I couldn't hardly walk around. I needed my companion's help out the door. It was kind of humbling, I guess is a good way to put it. And so a lot of, and the weird thing with dizziness is there's lots of different kinds. There's vertigo, which I later found out that I didn't have in terms of the technical definition of vertigo. I thought it was vertigo initially, but they tested and no, it wasn't. But yeah, they had me do like I went to an ear, nose, throat specialist, and they, I'm trying to remember, I think it's called a VNG, a video nystagmus, something, some medical thing where essentially like they stick these camera, like these, it's sort of like goggles that like look at your eyes and track the movements, and then they do various different stimuli that may or may not make you dizzy. And they'll like, I did the VNG twice. The first time they blew like hot air into my ear, and then they did cold air, and it kind of messes with the crystals, and it's like, okay, the whole room is spinning now. And so and then they did water was the second time. I honestly like the water because it kind of cleans out your ears, but that's random. Anyway, and so, but we essentially determined it wasn't vertigo, which there's at least 10 to 15, if not more, different types of vertigo, and there's a number of different sort of treatments. One of the treatments that some people do is they'll have to sort of like lay their head back, and there's a number of sort of head movements that try and realign the crystals in your ear. And so, but for the Chiari Malformation, which when I came home, we did the MRI and said, oh, well, we weren't expecting that. And so, I've also kind of had chronic migraines. And so for a little while before we did the surgery, we tested just a number of different medications to see if that did it. And that was more or less than helpful. And so we did what's called a decompression surgery, where they took out part of my skull, and then they cut into the dura, which is like an inner layer, and then covered it back up. And if anything, I'm glad that I did the surgery, because if I were to get like a car accident, or if I lifted something real heavy, it's possible that my brain could hemorrhage. But now with that, since there's more room, I mean, there's not a whole lot of room back there to begin with, but with the decompression, I don't have that danger anymore. It's hard to say if it has cured my dizziness, because I still get dizzy on and off. I think there's a lot of other factors that can lead to dizziness. Don't be afraid to check your thyroid, if that can be a possibility. And ask the doctors like how your levels are compared to what is like where the boundaries are. I know my mom, she's had thyroid issues, and taking the thyroid medication has helped her, even though she's technically not in that range where they think, oh, we've actually got to treat this. So that's another thing. Another treatment for dizziness could be trying vitamin D supplements. I've heard that's worked for people. So yeah, but I guess unique is a good way to classify what I've got, and I mean we're still trying to figure it out, which is kind of, it's a different situation, I guess. But so if you have dizziness, don't expect to go home early, but and don't anticipate having what I have. But do the tests though. It's so you can at least narrow down what it possibly is. So